Hi friends, I wanted to share with you an interesting case from fellowship of a refractive lens exchange in the setting of high myopia. This is a case of a 39-year-old male with very high myopia of about minus 17 diopters in both eyes. The patient was interested in refractive surgery and spectacle independence. They had a clear lens and good visual potential aside from some myopic degenerative changes of both fundi. Their preoperative best-corrected visual acuity with glasses was 20/20 in the right eye and 20/25 in the left eye. After looking at biometry and corneal topography, we offered them several options, including implantable Collamer lenses, refractive lens exchange, and refractive lens exchange with additional PRK for residual error. The risks and benefits of each of these procedures were discussed. The patient decided to proceed with only a refractive lens exchange due to several reasons. Primarily, they wished to undergo a fewer number of procedures to lower the risk of developing a retinal tear or detachment. They opted against an ICL due to risk of developing early cataracts, which would necessitate removal and additional surgery. In addition, finances were a concern given the refractive nature of this procedure, and they wished to avoid additional fees for PRK treatment. Upon reviewing the patient's biometry, we note a very long axial length of around 31 mm in both eyes. For the left eye, which was operated upon first, this called for a plus 0.5 diopter power in the bag. They did not require a toric lens, given the minimal amount of astigmatism. They strongly desired a multifocal lens, and the ability to read on the computer was critical for their work. At the time of surgery, the lowest power multifocal lenses available to us were a plus 6 diopter panoptic lens and plus 5 diopter synergy lens. Unfortunately, the AT LISA trifocal lens by Zeiss, which goes down all the way to 0 diopters, is unavailable for use in the United States. As such, we decided to use two lenses, a multifocal lens in the bag and a minus power lens in the sulcus to achieve our desired result. Polypseudophakia is usually utilized in cases of a very short eye where an extremely high-powered lens is required for emetropia. However, this is an unusual application of polypseudophakia for treatment of high myopia, and we're the first to present this in the setting of a Synergy multifocal lens, which was recently released. In this patient, a minus 4 diopter MA60 MA lens was chosen to be placed in the ciliary sulcus. One thing that is important to note and counsel about in cases of high myopia is the risk of developing retinal detachment. According to several studies, there is a consistently higher risk of developing retinal detachment after cataract surgery in high myopes. Other specific risk factors include presence of lattice degeneration, younger age, and male sex. This patient had some lattice degeneration present prior to surgery, which was treated with laser retinopexy by a retina specialist. 2 months following the surgery in the left eye, the patient is happy with the best corrected visual acuity ranging from 20/20 to 20/30 and J3 over various visits. Having undergone the same procedure recently in the right eye, they are 20/20 and J2 at their last post-op month 1 visit for the right eye. Please let me know if you have any thoughts below in the comments. Thanks for watching.